Hey Mavericks, happy Wednesday. I am extremely excited to be here today because we have Frank Ricotta, the CEO of BurstIQ, and he's going to talk about COVID and blockchain, and we're going to dive deep into seeing what they're doing in order to help improve the way we age and the way we store our healthcare data. But as always, I want to make a big thank you to Serenity, who has really promised to engage our senior living communities over the next 3 months to give free opportunities to use their platform to stay connected to loved ones that are not always able to visit right now. So please make sure you check out serenityapp.com to learn more about their opportunity and their amazing platform to stay connected during the COVID pandemic. And with that, I'm going to turn it over to our Chief Inspiration Maverick, Catherine Wells.
Hey, everybody. So glad to see you again. Thanks for joining us. As always, if you have questions, please engage. We love to get live questions and get them answered with our guests. Before we dive in with Frank here, I want to remind you there are 3 things that we're doing at Mavericks for Senior Living around COVID-19, and that is specifically to ignite hope. So the first thing we're doing is Facebook Live interviews such as this. We want to know who else you want to hear from. We'll go out, we'll find the experts, and we'll get them on so we get your questions answered. We're doing this for you, so please tell us what you'd like to hear. The second is, if you send a text message with the words Ignite Hope with no space in there, just Ignite Hope, to 27126, you will get 30 days of text messages with inspirational quotes and things to help all of us remain positive during this time. And then lastly, we have some wristbands that we are selling for $5. All proceeds go to one of 3 funds that are fighting against COVID-19, the World Health Organization COVID-19 Response Fund, AmeriCares, or Feeding America. And you can choose where you want your donation to go. So thank you to everyone on the front line who's out there working. This includes absolutely everybody. There's too many to be named, but we appreciate you from all of us at Mavericks of Senior Living. Thank you for everything that you do. All right, now let's get to our interview here. So we are here with, as Francis said, Frank Ricotta, CEO of BurstIQ. Welcome, Frank.
Well, thanks for having me. I'm happy to be here.
Yeah, we're excited to talk to you. I have just enough knowledge about blockchain to be very dangerous, but I do know it can help us democratize information and secure information much better than we have for some of our current systems. So first of all, tell us a little bit about you and your background.
Well, I started out in the United States Air Force, spent the first set of years there, really too blind to fly, although my son's a pilot now.
Oh, that's awesome.
Blind to fly. I worked in the intelligence space and really more on the technology side, and took what I learned and really was driven by the startup bug. I mean, it was the early days of Silicon Valley, and went out and started a series of startups. The first one was a consulting organization. We ended up building products for the telecom industry. Then back to the cybersecurity space for one after that. Then I did some work in the health tech space, and finally launched BurstIQ back in 2015.
Oh.
Yeah, that's great. And Frank and I may be the only 2 Colorado Springs natives around. So we're a club of 2. No, I'm sure there's a few more out there. So hello to all my Colorado Springs natives. I don't live there anymore, but it's a great place.
Did you go to the Air Force Academy as well, or just in the Air Force?
No, I did go to the Air Force Academy, and
very cool.
I'm actually I live in Springs, but I'm a Pueblo native. All my wife is from Colorado Springs.
Ah, okay.
So, second home for sure. I've been here since 1992, not counting school.
All right.
Very cool.
All right.
Very cool.
So tell us a little bit what you're doing in the world of blockchain. So one of the things that you talked about here is creating international data sharing and research collaboration. Can you share more about that?
Well, that's actually an initiative we launched within the last couple of days. It's an initiative called Research Foundry. We're offering it as a free service, and the goal is to really bring all these researchers and collaborators together, which includes the innovation community, around consolidating data and data access, particularly around COVID-19 and other broader health issues. It's been an incredible ride over the last couple of weeks, and our team's been really focused on really stepping out to make a difference. And yeah, that's a page on Research Foundry, and we'll be announcing a couple of really big partnerships over the next few days that'll really facilitate a lot of research in this area, particularly long-term impacts of this pandemic, both physically and mentally.
And
really
who
cool.
would be someone that would go to this and participate with you?
Yeah, this is really geared towards towards public health officials, researchers, university or private researchers, and health professionals and other companies working on digital health solutions. So it's not a direct-to-consumer offering at this point in time. We're really trying to bridge all these gaps, and there's been a lot of air gaps between data, particularly around COVID. Really highlighted the fact that researchers are having a tough time collaborating and sharing and working together, and so are governments. And we're trying to pull that information together in one place so they actually can interact with it, drive some understanding, and make good decisions on the back end. So hopefully, as a person, you're going to see the impacts of what we're doing in response to better services that you're going to receive from your healthcare professionals and even the government.
So the goal, it sounds like, is to the end consumer, in that they get better services because everyone in sort of what I guess I'll call the supply chain up until that point has been communicating and collaborating. Is that correct?
That's correct. And there's another variation. I mean, we were talking before the show started about the need for privacy, and there's an interesting balance now with something like this pandemic is compromising individual privacy for the sake of public health, tracking where you're going, who you're interacting with, and the fact that have you been tested or not? Have you had COVID and have the antibodies, in terms of from recovering it. And some international jurisdictions are starting creating this thing called a blue card or immunity card to go with your passport that said, hey, you've been tested or you had it. Without a balance between a person owning, who gets to see that type of information, it could be a pretty significant encroachment on your privacy. But flip side, we need something like that too.
Yeah.
Do you think, Frank, we're seeing the importance now of really sharing data well and safely? I mean, is that becoming more of an issue as people are trying to tackle a vaccine or a cure or a care model?
Yeah.
Is that what you think?
Oh, yeah, absolutely. How you do it safe and secure, collaborate, and people who are inventing things, how they maintain their intellectual property ownership and value contribution. But the other thing is, I think the genie's out of the bottle with regard to telehealth and telemedicine. I mean, a lot of the rules and restrictions have been loosened from the government, and allowing more providers to participate. In fact, it might be the only way to engage for a lot of patient providers at this point in time. And I don't think we're ever going to go back to a mode where you have to go into an office for a lot of the treatment and the care that you may need.
And we just got notification today that as an assisted living provider, if we help with the telehealth visit with the doctor, we actually can get a reimbursement now.
Yeah, that's absolutely. It's a whole lot of, that's where a lot of the rules were being relaxed in terms of what's reimbursable. And that's a big thing. That's a big thing.
Yeah. And it's not very much, but it's enough to incentivize, I hope, because I love telehealth because I don't have to go in a doctor or a hospital and, those things. Because I think we're realizing, let's use our medical resources for what they're needed for, not just go to the hospital as, I got to go to the doctor. What?
Yeah. And, when you couple some of these cool things, like some of the precision medicine tests that you're actually able to administer at home, be it a cheek swab or some of these really cool devices that are little micro blood draws, you just put it on your arm, push a button. It's going to change the whole interaction with that virtual care encounter, and from the standpoint that doc or that care provider is going to know a lot more about you because of these kind of tests and information is available, including additional devices that may be we may be where or maybe around our houses.
Yeah.
Yeah, I think it's great. And I am very curious to see how it all plays out, because I have, for example, I have a client in Grand Junction who could not get rounding doctors to their assisted living facility to save their lives. And telehealth was too difficult. And now that the regulations have been relaxed a little bit, it gets easier and we can serve more people. It only makes sense. So I'm very interested to watch this. And I'm sorry, you called it the Foundry?
Research Foundry.
Research Foundry.
Yeah. It's actually built on our core technology. And we actually have a lot of customers using the core technology for to deploy new innovations in this whole thing called digital front doors, or your digital companions and navigator, maybe through a hospital, along with how patients may get access to advanced biotech and pharma therapeutics. So there's that whole side of the business. The Research Foundry is really more of a social impact initiative that we undertook, and we always want it to be free. That's the goal of Research Foundry, kind of push the boundaries forward for us.
That's awesome.
And the collaboration, I think, is a really important part of that. We're seeing more and more of that right now as people come together and truly collaborate across potentially competitive lines or other lines, just to work together. So it's great. And I would ask anyone in our audience who's listening right now, do you have experience with blockchain, and what is your thought on what's happening here with the Research Foundry? Just post it in the comments. So let's go to your next section here, which is engaging crowd intelligence and innovation to accelerate problem solving and solutions. How are you?
Yeah, this is really intriguing to me, the way you worded this. So I'd like to, I'm intrigued by the crowd intelligence. That's really drew my attention.
Well, okay, there's two parts to that. And this is actually a lot of fun for us and for me in particular. So last year we started opening up our platform for innovators around the world who thought they wanted to create a solution in the health space and really solve a problem. And we didn't really know what was going to happen when we did that. But what we started seeing now is groups all around the world starting to adopt the technology to deliver solutions. So we have a group in Australia that's really creating a personal health record, a team in Nigeria that's helping navigate individuals to healthcare providers, and I can go on. So it's really been fun to see that adoption. But the second part of that is where you see a lot of big organizations have innovation initiatives, but they sort of get stuck in a certain cycle of what they know and who they know. What this does is it opens it up to people who can now participate that couldn't participate before, all these millions of brains out there that may want to contribute. And then finally, I mean, we're all intelligent in and of ourselves. The data about us and how we live and how we feel, we're getting in more of a data of abundance versus scarcity. And together our collective intelligence about what's going on is a pretty important indicator anymore.
Yeah, and we've seen that globally, haven't we?
Yes, we have. Yes, we have.
I love how you phrased it as crowd intelligence, because so often we use crowdsourcing. So we're crowdsourcing this, we're crowdsourcing that. That's great. We're asking people anywhere to bring us information, but crowd intelligence takes it to that next level. How do we not only pull the information together, but use that information collaboratively to create solutions?
Yep. That's the only way we can, I think, anymore. It really is an interconnected world, and COVID is definitely showing us that.
For sure.
And it's showing us how if we really rely on the community and share data effectively and quickly, some great things can happen. That, it's not, as Catherine and I have talked about, it's not so much a competition, but it's a collaborative competition where it needs to be in a competitive idea, but not withholding key elements or key genetic strains or, whatever that may be that could further enhance, technology and keeping people safe.
Yeah, co-opetition, right?
That's what I was like. I couldn't remember the name.
Yeah,
Co-opetition.
that's okay. I gotcha. Okay, awesome. So I imagine that people in our audience have this question. What about the issue of private information versus public information?
Yeah.
That's a great question. And we started with a privacy premise that you should own and control all your data. And we started seeing a lot of legal movement and regulatory oversight, particularly in Europe, with the regulatory framework called GDPR. And what that means is you own your data and you can tell somebody stop using it. In the US, it's not only we're starting to see state and local jurisdictions adopt those kind of rules and regulations for general information about you, the kind that maybe on social networks. And we've always had this overview from a health and personal health information. So we got to start with privacy, which means that if any of that data is going to get out, you should know about it and you should consent to its use. So fundamentally, everything we do is the notion of consent. You should know, you should be able to pull it back, and you should be able to give permissions, even if it's a short period of time.
And it sounds so simple when you say that, and it's so difficult to do. Can you talk a little bit about that?
It's extremely difficult when it comes to data. We all have a story about, I go to see my primary care doctor and I may need to see a specialist or a family member. Getting the health information from point A to point B sometimes is hand carrying. It's even distributed by fax in many instances, let alone because of some of the rules and restrictions are so restrictive, the notion of sharing it even between providers electronically, there's been a lot of fear in doing that just from the government side. And that's some of the rules we've seen lightening up a bit with the telemedicine services recently, making it a little more transportable. And the Centers for Medicare and Medicaid have really been pushing this whole notion of patient ownership of data and transparency, and set a whole bunch of new regulations that are going to require our care providers to make that information available to us. So once it is, and how do you keep it safe? That's the second question.
So Frank, would it all kind of go into this central storage area that then I could decide who to disseminate it to, and it's kind of in this secure, I guess, cloud space, or what does that look like? Well, to me, your medical data, if I'm 60 years old, I could have 60 years of health data.
Oh, that's right. On average, we're going to see 20-some docs over our lifetime, let alone all the other care providers. But, I'm not a big fan of going into one central place. And this is really where the power of blockchain comes in, which is truly, and this is a little geeky, so please excuse me, it's truly the power of distributed computing and privacy. And so it really moves a lot of capabilities in the hands of a person on where their data is even stored and how it's accessed. And there's a lot of mechanisms in the background. But, blockchain, not just technology, but philosophy is about supporting individual liberty and rights, which include data rights. And I think that's where we're going to go, because we have so many players in the health ecosystem. I don't think we'll ever get to one place with everything, but we can begin to consolidate little repositories around you, a population of one.
That's cool.
Yeah, it's really exciting, and I'm looking forward to it as an individual to have that capability to own my data. I also would have loved that as I was the power of attorney for both of my parents, one of two powers of attorney. But it would have been nice to have that capability. So
yeah, awesome.
Francis, did you have a question?
Yeah, I want to know. This is always a fun one we like to ask. So who's a Maverick in your life?
Oh, that's always an awesome question. I'm going to start with my mom, because my mom from day one has always been someone who lived outside the box. She was one of the top educators in the country, and then administrators, and eventually a superintendent. She invented a lot of new ways to educate kids, and was always just this powerful force in advocacy for kids and kids education. So I'm going to say my mom as a starting point, and then I like what my kids are doing too, so they're pretty fun.
All right, that's awesome.
Oh, that's so neat. Well,
Cool.
shout out to your mom, right on, for being a powerful leader for your own children as well as other children. And what are your kids doing that's super cool?
Yeah.
Well, I mentioned before my son's a pilot, so he's in the Air Force, so he's actually deployed right now. So shout out to him.
Very cool.
Then I have 3 daughters who all decided to become engineers, which is pretty cool. So my oldest is a software designer, but also this incredible artist. She combines both together. And daughter number 2 is a biochem engineer with an MBA and just doing some incredible things. She worked in the energy sector for a while and is now back in the health sector with us. And my youngest is a mechanical engineer. So all kind of bucking trends and just doing.
That's awesome.
That's
it sounds like
impressive.
very smart children. So
I take that for my wife. I'm not taking no credit.
Wow. Yeah, well, you know what? Impressive all the way around. So shout out to all of them. That's really fantastic. And especially your son who's defending us in other countries right now as personnel. So after hearing this conversation, what action would you ask our audience to take?
Well, I think you have to know. And what I mean by that, it's not just about what's happening in your life that you can see and feel and touch, but what is your digital footprint? And such an important thing for your health and wellness as well in terms of maintaining your digital health. And the second thing is please stay connected. It's so important, particularly in this time of isolation. I have my mom, who I talked about, who's in her 80s. She just recently fell and broke her hip. She's now in a rehab facility because of this virus. We can't go see her. So if it wasn't for video, we couldn't stay connected.
Yeah. I like that. And we've been talking about being socially connected while we're physically distanced. So absolutely, we support that 100%.
And that's one thing I'm really excited about with the COVID is, as you said earlier, this telehealth, these televisits, that's really challenging somewhat kind of an archaic industry to start really thinking outside the box. That's what I'm excited to see, because when you start doing that, who knows what aging is going to be like, or how we can help people age in the next 5-10 years. I'm extremely excited about how this has forced us all to look internal as to what we can do different.
Health is an everyday, all the time thing. It's not just when you go see your doc.
That's right.
Well,
that's where we need to be.
Well said. And this is maybe a topic for a different time, but I would love to get your high-level thoughts on how people can advocate for their own data, because it's one thing to go to the doctor and say, I want access to my data. Well, here's your portal. That's not the same thing that we're talking about. So we'll talk about that at some point in the future.
Yes.
Yeah.
That's right.
And Kathy, I'm going to come to your favorite question here that we always have been asking during this COVID pandemic. So why don't you take it away for us?
All right. So standing 1 year from today, Frank, looking back, what would you like to see have changed?
Well, I'm gonna give you more of a soft feeling answer to that one. I hope we're a more gentle, kind world. I hope we realize that when we have this pause button that we had to take, for the health and safety of all those around us and for our own families, that we start recognizing what's really important versus what we thought was important, and the fact that we're all people again.
I love that. I support that 100%. That's really well said. And I don't think it's a warm fuzzy. I think it's a reality. And I think I'm with you. I strive for that as well. So thank you for sharing that with our audience. Now, if people want to learn more about you, learn more about what you're doing, how can they reach you?
Well, I think up on the screen is my LinkedIn profile. Feel free to hit me there, or on Twitter at FRICOTTA. Or connect with us via our website, which is burstiq.com, and that's BURSTIQ.com.
All right, Frank, thank you so much for joining us today. If our audience, if you have any questions or thoughts or ideas as you listen to this, maybe at a later time, please post them in the comments and we'll do our best to get the questions to Frank so he can get an answer for you. Thanks for joining us, Frank.
Oh, I had a very good time. Thank you for having me.
Yeah, and thanks for what you're doing with BurstIQ. It's really cool, and I'm excited to see how it's going to continue to progress and really have a positive impact on our health and wellness, both I think personally as well as digitally. So thank you.
Again, it really is a lot of fun and has a lot of meaning to it.
That's great.
Thank you. We look forward to hearing from you in the future.
You guys have a great day.
You too.